Good morning. Okay, today is Saturday, October 14th, 2023. Let's do a little sound check. Check, check, check. Okay, here we are. Let me see. Okay, here we are. Okay. Sound is perfect. So we should be all ready to go. Okay. Today's topic is an extremely important topic. And the reason is I get this request all the time and getting more and more requests. It is the yoga therapy for cardiovascular disease. And primarily, it is the pranayama and the meditation, which is the real treatment for cardiovascular disease. Now, as we say, in our Western medicine, it is all a reductionist approach. I have a heart problem. I have a blockage in the artery, coronary artery, which is causing what is called the coronary artery disease, what we call it, regularly called the heart disease. I'm opening that blockage in the artery with angioplasty, bypass, and that is a treatment. But the question here lies is that what is the underlying cause? What is the underlying cause of this coronary artery disease, and how can we prevent and treat? So in a yoga therapy, we are holistic. That means it is a whole body works in sync. A kidney function depends upon rest of the body function. Liver works because of the rest of the body. They're nothing isolated. So let's start with the heart disease, and then I'll call it cardiovascular disease, and then if you come down, sequence what therapy we're going to do. The cause of this cardiovascular disease or heart disease today, as I explained to the last class, is the activation of the limbic system of the brain, amygdala and hippocampus. And the activation of the limbic system is primarily from the sympathetic overdrive. Sympathetic overdrive primarily from our stress. And more than the stress, the real underlying cause today is insomnia and sleep apnea. So you have to tame, quieting down the limbic system. Taming of the limbic system is done by a relaxation response and activation of parasympathetic tone. So think about, not scientifically, even a grossly, an ordinary human being can think. My blood vessels in my heart, called coronary arteries, the coronary arteries in a state of relaxation. The inside the coronary artery and inside the old arteries is a lining called endothelium. Endothelium secretes a substance called a nitric oxide. Nitric oxide is a potent vasodilator. Nitric oxide is also released by nasal breathing, by your Bhramri pranayam, bumblebee breathing, by your Ujjayi pranayam, but all the nasal breathing, it stimulates the mucosa of your sinuses and secretes nitric oxide. So in a state of sympathetic overdrive, the blood vessels tightens up. They're in a state of constriction. And during the constriction, the inner lining, the endothelial health goes away. So if you think about in a simple, ordinary thinking, the endothelium starts to break down, endothelium surface is not smooth, and it starts attracting. It starts attracting your cholesterol, lipids, and calcium, and started forming a plaque, which is called a hardening of the arteries. At a certain point, due to our sudden change in hemodynamics, like sudden change in the heart rate, sudden change in the blood pressure, the plaque ruptures. Plaque ruptures, it causes complete blockage of the artery, and we got called a heart attack, or called acute myocardial infarction. According to our yoga and Ayurveda, these cholesterol, high fat, high sugar, all the high are the end product of the improper digestion of our food. If the food is properly digested, we do not have the substance which is called ama. In Ayurveda, it is called ama. And the digestion in Ayurveda is through your 5 senses, 7 coloring fruits and vegetables, and 6 taste. We have talked about it before and we'll talk about it again. So all the problem comes, the first, from the digestion of the food. Whole gastrointestinal system is supplied by parasympathetic nerve. Parasympathetic activation, what is called a vagal activation, the vagus nerve, brings the parasympathetic tone in our body. We have few other cranial nerves, oculomotor nerve in the eye, trigeminal nerve, facial nerve, glossopharyngeal nerve. They're also mediator of parasympathetic tone, but primary is your vagus nerve. And then we have a sacral output or sacral plexus from L2 to 4 lumbar up to the sacrum. All the outflow from the spinal cord is called your parasympathetic tone. So parasympathetic tone is called a craniosacral. Cranio is your head, cranial nerve. Sacrum is the end of your spinal cord. And sympathetic is called thoracolumbar. Thoracic is the chest and the lumbar is the lower part. All the outflow from the spinal cord in that area are sympathetic. So the first therapy for a coronary artery disease is a relaxation response, able to keep our body-mind in a state of relaxation. I showed you on the last time about the asanas, simple chest opening poses, like prayer pose to the back. Put your hand to the back and able to put into a prayer pose, like you have all have seen how to put a prayer pose to the back. And then when you keep on doing it for a while, you develop the sign of neuroplasticity, and you will be able to stay here for a longer and longer, as if this is your normal posture, which happened to all of us who've been practicing for a while. So I'm sitting on this, all of you have seen, this is my kneeling stool. So relaxation response, preparing your body for the pranayama. Asanas which prepare your body for pranayama and meditation is called sthiram sukham asana. Sthiram is the stillness, sukham is the happy, and asana. Like here, I'm doing a Paschim Namaskar, a prayer pose to the back. I have a stillness. I don't have any fasciculation in my muscles. Chest opening poses, back bends, and the side bends. Side bends like your, say, a Trikonasana, triangle pose, or your oblique mountain pose, Tirjak Tadasana, oblique mountain pose. These also increases your cardiac function, increases your ejection fraction. Back bends, the chest opening, like in fact you can do your, let's say, on the bed you can do a fish pose. In a fish pose, if you're uncomfortable, you can put some pillows under your chest and you can do a fish pose in the bed. You can do your, say, cobra pose, Bhujangasana, Dhanurasana, all the back bends and your chest opening poses. We do a, as I said, native jal neti every morning. And that is our part of our daily routine, and you get some. So the first therapy, as I said, activation of parasympathetic tone through a vagal nerve activation. So we'll show you all the pranayamas, how to activate the different branches of the vagus nerve. Second, quieting down your limbic system. Our mind, so-called our mind, is in the limbic system. Limbic system is regarded as your emotional brain, beyond your sensory and motor cortex. Content of your five senses. We hear, we see, we smell, we taste and touch. The contents of our five senses is our mind. So if you can shut down your five senses, which is the fifth limb of the yoga called a pratyahara. Pratyahara. Pratya means reject, ahar means input. So input is not through only food, input is all, hearing, seeing, smelling, tasting, and touching. So the first therapy is for a pranayama practice for cardiovascular disease, able to sit down with your spine straight. I've shown you repeatedly to sit down in a chair, keep your spine straight. Here is a special chair called a kneeling stool. If you sit down, you have to keep your spine straight. Bhramri pranayam, bumblebee breathing, followed by pumping and cupping, and massaging the earlobe, ear, and inside the ear. Ear, inside the ear and earlobe has a branch of the vagus nerve called auricular branch of the vagus nerve. If you stimulate the external auditory canal, if you stimulate your earlobe behind the ear, you will see a profound level of relaxation and calming. Parasympathetic is called calming and digest. Calm and digest. So let's do a set of Bhramri Pranayam followed by palming and cupping, and we'll explain everything to you. So, index finger in the forehead. You can do a Shanmukhi Mudra, or you can put your 3 fingers to close your eyes, then use your thumb to close your ear. You will breathe out first. Take a deep breath in, breathe out with the sound of a bumblebee. And you see this create a frequency. Brain has a frequency, 2 frequency interacts and cancels. It's called a harmonic resonance, and the mind quiets down. The nasal breathing also starts secreting nitric oxide. Nitric oxide is a potent vasodilator, and it's also an activator of your parasympathetic tone. Breathe out first. Take a deep breath in. Followed by palming and cupping. Keep rubbing your hands. Keep rubbing your hands. When you feel the warmth in your hand, if you're wearing glasses, remove your glasses. Use the hand like a cup. Put it over your eyes. The eye takes the heat, relaxes your ciliary muscles. This is also activation of parasympathetic tone. Oculomotor nerve. Then there are nerve supplies to the eyes called SO4, LR6. The muscle in the eye, superior oblique muscle, is supplied by 4th cranial nerve. The lateral rectus muscle is supplied by the 6th cranial nerve. All the cranial nerves, which is carrying the parasympathetic outflow, are getting completely stimulated with the parasympathetic outflow. When ciliary muscles are relaxed, your lens becomes more convex. It almost acts like you're reading glass. You don't need a glasses when you practice. Massage your forehead, massage your eyes. All the muscles are attached in the skin, in the face. So the muscles are relaxed, all the lines goes away, all the frowning goes away, all the lines in your face goes away. And people will say, look at your skin looks so good. Skin looks good because you have a peripheral vasodilatation. Blood vessels under the skin opens up and dilates, brings more nutrients. Then you take your hand, massage your earlobe, massage behind the ear, then also put your finger inside and stimulate the external auditory canal. I have the AirPods, but you can put just very simply. You will see when you stimulate the external auditory canal, you feel a profound level of relaxation. Bring the hand and massage on the side of the neck. There is got a carotid sinus. The carotid sinus is having a baroreceptor nerves. This is the heading nerve of your glossopharyngeal nerve. And this glossopharyngeal nerve takes your impulse to your brainstem. And the output is through vagus nerve, which quiets down and comes down your cardiovascular system and nervous system. Take your hand to the back, massage the muscles which is attached to your tubercle. This is your accessory muscle and sternocleidomastoid muscle. Both are supplied by your cranial nerve. So this is the beginning of your pranayama practice for cardiovascular disease. Before that, you start having a very simple practice of breathing, exhalation longer than inhalation. Sit down with your spine straight. Touch your index finger and thumb. This is called a Dhanu Mudra or Gyana Mudra. Put it over your knees. Close your eyes. So you quiet down your mind now. You bring your awareness to your breathing. Your lung is like a balloon. It has 6-liter capacity. It needs 1.5 liter to keep it open. We have 4.5 liter of air which you can exchange, which is called vital capacity. Normal breathing, we only breathe only 500 cc, half a liter. So 80 to 90% we have a breathing reserve. You have an inspiratory reserve, the air you can bring in, it's almost 3 liters. Expiratory reserve, the air you can bring out of a normal breathing, is almost 1.5 liters. So I'm already having a saliva in my mouth. My mouth is wet. I've been talking to you for so long. There's saliva in your mouth, lacrimation, like a tear in your eye. These are the sign of parasympathetic activation. People come and say, I have dry eyes. I'm putting all this stuff. I took a diastasis. I'm doing this artificial ear. Nothing is helping. Parasympathetic activation, going to start your lacrimation, formation of tear. Parasympathetic activation will reduce your dryness in your mouth. So breathe out first. Slowly breathe in as long as you can without any effort. And breathe out longer than breathing in. Keep doing it slowly. If you want to count, you can do a count of 2 in and count of 4 out. Very simple, 2 seconds in, 4 seconds out. Breathe out first. Count of 2 in, 1 and 2 in. Count of 4 out. So easy. If you continue this, you develop a neuroplasticity. When you develop a neuroplasticity, that's the way you are going to breathe. Your exhalation will be longer than inhalation. We've been doing it so long, we can do even 6 seconds in, 12 seconds out, 8 seconds in, 16 seconds out, 10 seconds in, 20 seconds out, without any effort. Remember, all the pranayama for cardiovascular disease, you have to do it completely effortlessly. The effortless breathing means that you should be able to talk, you should be able to sing during your pranayama practice. Just to show you what I'm talking about. With my eyes closed, silently, I will be able to do 8 seconds in, 16 seconds out. Breathe out first. Sorry. When you do a proper breathing through your nose, when the air really goes through your larynx without going any air through your esophagus, you do sometimes develop a cough because the cough originates in the level of larynx. Entirely normal. Don't get any surprise. Breathe out first again. You did the 8, count of 8 in, count of 16 out. I'm completely effortless. I'm talking, I'm breathing, I'm singing. When they talk about activation of the vagus nerve, so first branch of the vagus nerve is your auricular branch of the vagus nerve. Next branch which comes in your pharyngeal plexus, then will come the laryngeal plexus. Pharynx is the first. No. So what you do, when you have when you have to bear down, like you want to contract your, lower part of the gastrointestinal tract, like a rectum, anal canal, or bear down your uterus. All of the bearing down, remember, what we do, we said we take a deep breath in, we hold the breath and start to bearing down like this. So remember, bearing down does not transmit the pressure down to your anal canal or rectum. Bearing down, it stimulates your vagus nerve, which is a parasympathetic nerve, and all the outflow of the gastrointestinal tract is a parasympathetic nerve, so that starts contracting and you're going to have a bowel movement. If you have a problem, and bearing down helps. Next is your Valsalva maneuver. In a Valsalva maneuver, which in Ayurveda or yoga called a Korno-Rogantor Pranayama. Korno means your ear, Rogantor means Rog-Antar means all the disease in the ear goes away, and Pranayama. Basically, there is a tube connecting from your ear to your throat called eustachian tube. The tube gets blocked. And you know very well that when it happens on when you're in a plane, aeroplane, when there is a sudden descent, the kids will say, all the kids starts crying, and you will see you get a blockage in your eustachian tube. So what do you do? First, you try to swallow. Deep swallow. Swallowing is your parasympathetic activation. And it also generates some pressure. So what you do, breathe out first, take a deep breath in, hold, close your nostril and mouth, try to breathe out against the resistance. It activates the vagus nerve, pharyngeal branch, and then it also opens up the eustachian tube. Let's try one time. Breathe out first. Deep breath in. Both the eustachian tube opened up. You could feel it. Valsalva maneuver or corno-roganto pranayama, bearing down, stimulates the pharyngeal branch of the vagus nerve. Laryngeal branch of the vagus nerve, larynx, the vocal box, is supplied by 2 or 3 laryngeal nerves, which are the branch of a vagus nerve. First one is the superior laryngeal nerve, inferior laryngeal nerve, and a recurrent laryngeal nerve. Superior laryngeal nerve supplies the cricothyroid muscle. Inferior laryngeal nerve and recurrent laryngeal nerve supplies the intrinsic muscles of the larynx. And when you learn how to constrict the larynx slowly, effortlessly, it stimulates your vagus nerve. What is interesting is the recurrent laryngeal nerve on the right side, it comes down to your subclavian artery, it turns around the subclavian artery, then it goes high up. That's called recurrent, going high up. In the left side, it is more interesting that it comes almost to the arch of the aorta. It turns around the arch of the aorta, then goes to your larynx. Ujjayi pranayama. Ujjayi pranayama is slowly close your larynx and try to breathe in and out against a resistance, which is called a resistive inhalation. Initially, you do both inhalation and exhalation. This will also sound like what is called a Darth Vader breathing, or you call it ocean breathing. Then when you tighten up a little bit more, you will have a sound like a resistive inhalation and an inhalation sound like this. So let's do a full Ujjayi pranayama. Breathe out first. Take a deep breath in, long breath in. Breathe out as much as possible and trying to breathe in with your larynx and the throat. This is telling you that you have done a proper Ujjayi pranayama. A cough, when you get a cough, that means you have constricted lungs. Also, see, my hand automatically goes into it is called Adhi Mudra, or called Palo Mushti Mudra. It's a very relaxation. This is the way the baby fist. A baby will close the fist like this. So we do relaxation of our hands. All the practices you do, we like to do it in either a Dhanu Mudra or a Gyana Mudra, which quiets down your mind, or in an Adhi Mudra, which is a very relaxing mudra. We'll talk about alternate nostril breathing. Alternate nostril breathing also is called a Vayu Pradhan Pranayam. It controls your Vata energy, excess Vata, and Vata pushes Pitta. Pitta is the energy for the cardiovascular disease. So alternate nostril breathing or Anulom Vilom Pranayama is your therapy for the cardiovascular disease. Left nostril is controlled by the right brain. Right brain is intuitive, female, cooling, parasympathetic. So left nostril breathing is calming, cooling, and parasympathetic. Right nostril is controlled by the left brain, which is analytical, male, heating, sympathetic. So right nostril breathing is sympathetic. So left nostril breathing is for your cardiovascular disease, because cardiovascular disease wants a quieting down. See, exhalation. Inhalation is sympathetic, exhalation is parasympathetic. So inhalation, the heart rate goes high up, exhalation, heart rate goes down. This is called a sinus arrhythmia. And that's a normal pattern. That's what you need. So we'll show you a little later how to do a Ujjayi pranayama with chin lock, Jalandhar Bandha, and the left nostril breathing is a therapy for cardiovascular disease. So after laryngeal plexus, you come down, the activating the vagus tone is your carotid sinus massage. Carotid sinus is at the bifurcation of the carotid artery. There's a common carotid artery which divides into external and internal carotid artery, and that is a supplier of your baroreceptor nerves. Baroreceptor activation comes and quiets down your cardiovascular system. Baroreceptor activation acts like your beta blocker. A relaxation response, activation of parasympathetic tone with the reduction of the peripheral resistance acts like your ACE inhibitor. So what are the medications we take for cardiovascular disease? Aspirin, statin, beta blocker, ACE inhibitor. Function of aspirin, which is anti-thrombotic and anti-inflammatory. We get it done through our water metabolism and daily your dinocharya. Statin, cholesterol. Our cholesterol is needed to produce your cortisol, to produce your bile salt. Cortisol is the hormone for your stress. When the stress goes down, cortisol level goes down, body doesn't need any more cholesterol, cholesterol level comes down. When a food intake is correct, when there is a optimal food intake, we eat plant-based, 7 coloring fruits and vegetables with the 6 tastes, what we talk about ideal food intake. You don't need that much of bile salt, you don't need that much of a cholesterol, and the cholesterol level comes down. So if you put all of them, we put a training for the cardiovascular cardiologist that all the functions of the aspirin, statin, beta blocker, ACE inhibitor can be initiated by a practice of yoga therapy. Carotid sinus massage is done through called your chin lock, Jalandhar Bandha. There are 3 bandhas: root lock. Root lock, when you contract your pelvis and rectum and pull it up, that is also parasympathetic. Abdominal lock, called Uddiyani Bandh, it is an exhalation and then suck it in your stomach and hold, and that creates a negative pressure in the abdomen, and it also a parasympathetic activation. And a chin lock, Jalandhar Bandha, is your activation of your carotid sinus, which is a parasympathetic activation. We can put all of them together, which is called a Mahabandh. So in a Jalandhar Bandh, what you do, you breathe out first, take a deep breath in, slowly drop your chin down towards your chest, and keep doing normal breathing, breathing out, normal, then breathing in. In a great lock Mahabandh, you slowly breathe in, long breathe in, breathe out, contract your pelvis, pull it up, suck your abdomen in, and do a chin lock, and hold as much as possible. I'll show it to you one time. Then comes your breath holding. Very, very important. And people will scare you. You have a cardiac disease, you have a high blood pressure, don't do breath holding. No, not a breath holding. You do it very simply as if it is a normal breathing. Don't stress yourself doing a pranayama. People say, do it very slowly, Bhastrika pranayama. But what will happen when neuroplasticity sets in, you'll be able to do as fast as Bhastrika possible, but you'll still be able to talk, breathe, and it's a normal breathing. Same way, breath holding. Breath holding in inhalation is called Abhantarin Kumbhak. Kumbhak is the breath holding. Abhantarin is the inhalation. Breath holding in inhalation. So the inhalation, then you have a breath holding in inhalation, then has the exhalation. Then the breath holding in exhalation. You breathe out and hold. Breath holding in exhalation is called your Bajja Kumbhak. Breath holding in exhalation is generally, you see, how long you will hold. Simplest way to do it, breathe out first, slowly breathe in as long as you can, and hold your breath. See how long you can do it. Both breath holding in inhalation and breath holding in exhalation are basically a parasympathetic activation, and these are in yoga called Mrito Sanjivani. Mrito means dead, Sanjivani means alive. It makes a dead person alive. It is such a powerful your practice. And remember, heart and lung is the same organ. You improve the lung function, you'll improve your heart function. Heart function gets better, brain function gets better. Brain function gets better, all the cellular function gets better. So when your lung stops, when you die, when your lung stops, what happens? We expire. Lung stops, the heart stops. Heart stops, the brain stops. Brain stops, all cellular function stops. So let's see. That's okay. Let's just say breath holding and exhalation. Breathe out first. Over 35 seconds. It is a powerful respiratory function, breath holding in exhalation. In medical term, we call it BOLT. B-O-L-T. It stands for blood oxygen level tolerance. Yeah, blood oxygen level tolerance. So it shows you how much, the blood oxygen level, which you can hold your breath. On the other hand, when you do a breath holding in, remember, you don't do this thing right away. You do it what your body will allow. It could be within 5 seconds, but keep practicing. After a few practice in a neuroplasticity sets in. From the 5 seconds, it will be 7 seconds, 7 to 10 seconds, 15 seconds. We've been doing it for long enough, that's what we can do, 30, 35 seconds. When you breathe in and hold the breath, called a breath holding in inhalation, which is called Abhantarin Kumbhak, the air is inside the lung and the lung starts to expand. When the lung starts to expand, it goes up to almost to your outside in the rib cage, but you have a rib cage. Lung cannot expand anymore. So body has a mechanism to put the lung back in expiration and bring it back to the normal level. And this is done through a reflex called a Herring-Brewer reflex, which is mediated through vagus nerve. So breath holding in inhalation is also parasympathetic activation because of activation of parasympathetic nerve through Herring-Brewer reflex. In yoga, it is the activation of the carotid sinus through a chin lock called Jalandhar Bandha and activation of vagus nerve through your breath holding and inhalation. Putting it together is called a Murcha Pranayam. And Murcha Pranayam is so powerful pranayam. It's called Murcha. Murcha means unconscious. You know, you became so relaxed, you feel like unconscious. See me, my mouth is still absolutely wet with all the saliva. I have not touched a single water. And look at how long I've been talking. So let's show one Murcha Pranayam. Okay. See, all the pranayams are there in my pranayama practice session. You can go to YouTube and take a look. These are the main pick and choose for a cardiovascular disease. So Murcha Pranayam will be, say my hand is again goes back to your Adhimudra. I'll be breathing out first, take a deep breath in, I'll hold my breath and put my chin down in a chin lock. Breathe out first, then take a deep breath in. Could hold about 45 seconds, practice it for some time, but don't practice this. You know, whatever your body will allow, remember to listen to your body. Always do yoga practice for asana, no pain, and with the effortless breathing. Breathing has to be totally effortless. So for a good yoga practitioner with the proper lung function, you can do breath holding and inhalation almost a minute. 2 minutes is, oh my God, wonderful. A lot of, deep sea diver, I mean, the people go under the sea with a practice, they can do 3 minutes. They can almost go up to 8 minutes without oxygen. And sometimes they take some oxygen beforehand, then the diver goes down, they can sustain sometimes 15 to 18 minutes. 8 minutes is the max you can think about. 3 minutes is the max. For us, 1 minute, if you can do up to 45 seconds to a minute, you're one of the ideal yogi practitioners. So to come up to here through your vagus nerve. Next, the branch of the vagus nerve will be the cardiac plexus, pulmonary plexus, which is being activated by your breath holding and inhalation called the Herring-Brewer reflex, the vagus nerve. Then the vagus nerve goes down, the posterior one goes to the back, and right one goes to the back, and left one goes in front of your gastroesophageal junction. So a very slow Kapalbhati pranayama is ideal for cardiovascular disease. So you have seen a Kapalbhati pranayama, so which you will be, if you really want to do it more and how to do it, you can go to my YouTube channel and look at the pranayama practice. And I think it's the beginning of this year I did start a pranayama practice. So when you do the Kapalbhati pranayama, so there is a balloon, there is a diaphragm, there is another balloon. You have your attention at the belly button. If you push your belly button to the back, then it hits your diaphragm. Actually, first it massages all the intra-abdominal organ. Massages your liver, your stomach, your spleen, your colon, for the women, it's your uterus, your ovaries, fallopian tube. For men, it's a prostate, bladder, you name it. All these things get stimulated. And yoga says if you massage your organ, it functions better. Then also, it's a massaging in the gastroesophageal junction, it stimulates the vagus nerve. On the other hand, when it also massages your diaphragm, it massages both the lung and the heart. So when you do in the heart, the massages in the heart, what it does is you're slowly massaging the heart. So when you massage the heart function improves. CPR, cardiopulmonary resuscitation. So we do the chest compression primarily to massage the heart. In fact, in our cardiovascular practice also, patient comes sometimes with a cardiac arrest. We used to do a left thoracotomy, open the left chest, hold the heart, and when I pump it, we used to pump it with our bare hand. We have a very gloves on. So slow Kapalbhati pranayama, call it is like an internal CPR. So we do with all the mudras, 10 mudras. Generally, our practice is 50 counts with each mudras, and generally about. So very simple. Bring your awareness to belly button. Push the belly button to the back. Your awareness is nowhere else. So I'm doing all the exhalation. It is an active exhalation without inhalation. I'm inhaling in between without knowing. So I don't need to know how to breathe in, because the day I was born, I took a deep breath in. I have to learn how to breathe out. So many people say, I cannot do it. So new people are new. You can put your hands, hand goes in, air will come out, because it pushes your diaphragm and the lung. Then you say both of your nostrils are open. So this is the active exhalation, passive inhalation, Kapalbhati pranayama. Name came here because Kapal is a forehead, Bhati is a shining. It is called your Agni Pradhan pranayama. It ignites your digestive fire, in the whole fire in the body called Tejas. When you do Kapalbhati pranayama, looks like you are glowing. There is an aura around you. People will tell you, your skin looks so good. You don't have any wrinkles. Wonderful practice. Slow Kapalbhati pranayama. If you do it, you'll be hooked to it. You'll never leave home without doing it. Very slow, 1 per second. When you do very rapid Kapalbhati pranayama, it becomes a kriya. There are 6 kriyas. One of the kriyas is a Kapalbhati. You need to improve the lung function for a good cardiac function. So after all the vagal stimulation, and you could do what is called your Bhastrika pranayama. Bhastrika is the active inhalation, active exhalation. So it's like a bellows, and you must have seen the bellows. I think I have shown it to you before. So this is your bellows. Somebody gave it to me, one of my friends. Inhalation, exhalation, inhalation, exhalation. Active inhalation, active exhalation. We do it hand raise. Generally, we do it count of 20, slow, 20, medium, 20, fast, one cycle, then you continue the cycle. 20 slow. Let's do 10. We don't have a timing wise the 10. 10 slow, 10 medium, 10 fast. I'm showing it to you. There's a one cycle. Generally we do 20, 20, 20, but I'm doing 10, 10, and 10 very rapid. We call it Vishnu, Vishnu. We do repeat the cycle. We do about 3, 4, 5 cycles, and it is and a lot of your secretion will come out. Both the nose gets opened up. Bhastrika Pranayama improves your lung function, and actually Bhastrika Pranayama is a gateway to Pranayama. You can also do without raising your hand, but simply sitting down. Again, Adhimudra, and very slow, you can do. Or you can do very slow inhalation and exhalation. We've been doing it for so long, we can do very rapid and for a long time. Do sometimes 500, 1,000, sitting like this. I'm still talking, I'm still singing, I'm normal breathing. All this faster pranayama I done because breathing is still effortless. So, there's a lot of other pranayamas, which is very powerful pranayama. One is your Shankha pranayam. Shankha pranayam is your like blowing a conch shell, what is called a resistive exhalation. If you don't have any conch shell, use your hand, use your Adhimudra. You really don't breathe through your mouth, you always breathe through your nostril. both inhalation and exhalation. Somebody says, I have a problem with my nose, I need to breathe through my mouth. If you have to breathe through your mouth, you can do some exhalation through your mouth. Because if you breathe in through your mouth, you don't know where the air has gone. It's gone to the lung, it's gone to the stomach, so you do it through your nose. Use your mouth for pranayama practice. Like the powerful pranayama is called a cooling pranayama. Sitali pranayam and sitkari pranayam and shodanta pranayam. So here also, breathe out first, breathe in through your nostril and trying to breathe out through your mouth against the resistance, resistive exhalation. Breathe out first and deep breath in. Shankha pranayama, resistive exhalation. Sitali and sitkari pranayam. Sitali, you take your tongue out, roll the tongue, breathe in through your mouth, breathe out through your nose. Within a few breathing, your inside gets completely cooled. Very effective for cardiovascular disease, effective for your hot flushes for the women, effective for your gastroesophageal reflux. So tongue out and roll. Cannot keep your tongue out, put your tongue inside with the teeth and upper palate and breathe through your teeth. Shodanta pranayam is clench your teeth, touch your upper palate, and again breathe it through your teeth. This is all called cooling pranayam. Chanting pranayam, like a Om pranayam, and it is a continuous exhalation with the sound of Om, A, U, Ma, which is also called your Pranaho pranayam. There's also called a lot of pranayam, Savitri pranayam, which is breath holding, 1:2:2:1. Then you have a Plavuni pranayam that you can do. So let's show one time, call your A-U-Ma, the pranayama for your chanting. Pranabhu pranayama. A comes from the lower part of the lung, U from the middle part, Ma comes from the upper part. Starts with 3 mudras. When you touch your index finger and thumb, put your hands down, called a chin mudra. So the A. Close your fingers, it is called a chin mudra, middle part of the lung. U. Then in the Adhi mudra, it opens the upper part of the lung, called Ma. See, Pranabho pranayam. Chinmayi Mudra, U, middle part of the lung. Adhi Mudra, Ma, upper part of the lung. And generally, this follows with your pumping and cupping, which I've shown you before. Let's finish with a alternate nostril breathing, and I'll show you the alternate nostril breathing with your concentration on the third eye and the balancing, and then you can do also alternate nostril breathing when you're in a meditative state without closing your nostril. Then you can do a Nadi Shuddhi Pranayama, which is breath holding. So in alternate nostril breathing, use your left hand in the Dhyana Mudra, close your right nostril. You don't have to push all the way down, just push underneath. So you breathe out first through the left nostril, breathe in through your left nostril. Close your left nostril, breathe out through right nostril, longer than inhalation. Breathe in through your right nostril. Breathe out through your left nostril. As we already said, left nostril is controlled by the right brain, which is intuitive cooling, parasympathetic signal and cooling. So left nostril is parasympathetic activation. Chandra Vedi Pranayam, moon energy. Right nostril breathing controlled by the left brain, which is analytical, male heating sympathetic, which is called Surya Vedi Pranayam, sun energy. Left nostril breathing is more effective for cardiovascular disease, but alternate nostril breathing balances your vata energy, which in turn balances your pitta energy, controls your cardiovascular disease. You can bring a more concentration. You put your index finger and middle finger on the third eye. Your eyes are always closed. Bring your awareness to the third eye and continue your alternate nostril breathing. Within a short time, you'll be in a totally transcendental state. Then put the balancing back. You can bring your left hand, hold your right ear lobe, which is your super brain yoga. It balances both sides of the brain. And do alternate nostril breathing. For cardiovascular disease. Nadi Shuddhi Pranayam. Nadi means channel, Shuddhi is clean. So for whole cardiovascular disease, the whole yoga practice is called Agni Deepana. It ignites your Agni, the fire within the body. Ama Pachana. Ama is your undigested food, which is our most important disease. High cholesterol, high fat, high sugar, high everything. And Ama is the mother of all disease. Ama Pachana. It digests your Ama. Digests the whole food. Agni Deepana Ama Pachana. Nadi Shodhana. Cleans all the channel. So prana can flow and brings your health back. And Ojo Sthapana. Ojo is your immunity. The Sthapana is create more immunity. You get your food properly digested, you produce a Ojo. So, when you do the Nadi Shuddhi Pranayama, you take your index finger, put it down, and make a called a Vishnu Mudra. You basically incorporate a breath holding. Like you inhale with a count of 4, breath hold with a count of 16, breath out count of 8. And we can do it effortlessly, you can keep increasing the number. But ratio remains same, 1:4:2. Get a 5 in, 20 hold, and 10 out. Then we show with a count of 4. Breathe out from your left nostril. Breathe in with a count of 4 in. Breath hold for 16. Breathe out, count of 8. So one bit more. Breathe in, the opposite nostril, the count of 5 in. Breath hold to the count of 20. Breathe out to the count of 10. So one round of Nadi Shuddhi Pranayama. Let's finish with the most profound. Another also, you'll be able to do all the alternate nostril breathing with your nose closed because you are properly connected through your subtle body, the body of your mind. It will be Ujjayi Pranayam followed by your chin lock, Jalandhar Bandha, then the left nostril breathing called Chandravedi Pranayam. So this will be your D therapy for cardiovascular disease, Adi Mudra. Breathe out first, slow, long breathe in, breathe out, Ujjayi Pranayam with a chin lock. So what we have done, we have hit the root cause of our cardiovascular disease, taming down the limbic system, amygdala and hippocampus, that is quieting down your mind. Relaxation response, when your body is relaxed, your blood vessels are relaxed. We're not reductionists, yes, holistic. Activation of parasympathetic tone with the different branches of the vagus nerve. Vagus nerve, 80% is the input, information going to the brainstem, and 20% is the output. So we have all the ways of stimulating your branches of the vagus nerve for an input. 80% is the input. So all the practices. Thank you again for joining. Next weekend, we need to see what is our program is. There may be called Durga Puja, a celebration. And then, as I said, if I'm town, we'll be doing, depends on your request. If you put another request, go ahead and take care of it. So thank you for your participation. We'll see you next Saturday. Again, put any comments, any questions, and we'll try to follow it through your Facebook.